Hello everybody, this is Dr. Joseph Danyo from Danyo Plastic Surgery, and today we are discussing pre- and post-op care for your upcoming surgery. This is obviously helpful for patients going through this big process, as well as for friends and family who will be assisting you before and after surgery. So what to do prior to your surgery? First of all, make sure that you double check your location. It may be different for this surgery if you've had surgery by me elsewhere or a previous time. So options include the Doc's Surgery Center or the Christiana Care Wilmington campus. Look for a call from anesthesia from either the Christiana Care Wilmington anesthesia department or the Doc's anesthesia department. They're actually both the same team, but they are different systems. So that number may come up as unknown to you, but please answer that phone call because they do like to do pre-op phone calls and try to identify any issues that could be a glitch prior to procedures. Do you need to see your family doctor? If you have multiple medical problems, multiple medications, or any anxieties, concerns about your medical condition, please see your family doctor, and they can, of course, see you prior to surgery and allay any fears or order any tests that they feel would be necessary and helpful prior to your procedure. Medications, what to do about them. In general, most medications are taken prior to surgery, even the morning of surgery, typically with a sip of water. Aspirin and Motrin products generally are stopped 10 days prior, but if you have a cardiac issue that we're unaware of, or that you feel that the aspirin is very important for your overall health and safety, then please discuss that stopping of aspirin or Motrin with the office prior to the procedure. If you take strange supplements, generally it's recommended to stop them. If no one's heard of the supplement you're taking, it's probably okay to stop it. Things like fish oil, aspirin, garlic are known mild bleeding concern issues, so they can be stopped. Tylenol for pain is always okay prior to surgery, does not cause any bleeding problems. Piercings. Generally, piercings are recommended to be removed prior to arriving at the surgery center or hospital. If, however, the removal of the piercing is difficult or uncomfortable and may not be necessary, then it's okay to leave it in place, and we can discuss whether it needs to be removed at the surgery center or hospital prior to the induction of the anesthesia. Now that we've talked about the do's, let's talk about the don'ts prior to surgery. First of all, make sure you don't eat or drink after midnight. This is a very common anesthesia request and demand, so it's oftentimes a reason for anesthesia to be canceled. If you take Ozempic or other weight loss drugs or injections, please stop them 2 weeks prior to surgery, not just 1 week prior. This is another anesthesia request to help with safety through anesthesia. If you smoke, we've probably talked about this already, but it's very important if you stop smoking immediately, particularly 2 weeks prior to surgery. 2 weeks stopping smoking has been shown to be a risk reduction in wound healing issues and is highly recommended, and could be a reason to actually cancel the surgery if smoking is still actively being done prior to surgery.